We're going to start the session. Get ready. So Carol Potter, worsening osteoarthritis. Mrs. Carol Potter, worsening osteoarthritis. And this is the case. You can see from here. You can just download here. Okay, from here. This is the post link. You can download from here. This is the case. Okay, case notes you can download from here. Okay, you can also download from here. So you can download the case notes from there. Now, let us see. For example, so if you're a doctor, you write doctor. If you're a nurse, you write nurse. Okay, right. The same letter is given by many people. So many nurses are writing. So it's okay. We are learning something. So 70-year-old woman, right? Worsening osteoarthritis. Okay, worsening osteoarthritis. So worsening osteoarthritis. That is the point. The name of the patient is Mrs. Carol Potter. Right. And she's a 70-year-old woman. Okay, date of birth is given and age also is given. So you can use any one. Right. And here it is. You're addressing the letter to Dr. Lee Walters. Okay, Dr. Walters. Dr. Waters. Dr. Lee Waters. Surgeon. Stillwater Private Hospital. Stillwater Private Hospital. 54 Main Street, Stillwater. So this is the address. This is the address. So you are going to take the address now from here. You are going to take the address from here. This is the address. Control C. Yes. This is the address. To Lee Waters. Okay, enter, remove comma. Surgeon. Enter, remove comma. Stillwater Private Hospital. Enter, remove comma. Stillwater. So this is the address. So make sure that this is the address. Okay. Fine. Write down in your notebook. Okay. Now you can learn afterwards without seeing anything. You have to write. Okay. So this is the address. This will go into your letter. Fine. So this is the address. So this is the topmost point. So let us take what is that? Yeah, fine. So, this is quality check answer sheet. So we are opening this one. So this is answer sheet, quality check answer sheet. So we are going to write those things here. Leave the first line and you can start here. Dear Dr. Lee Waters, surgeon, Stillwater Private Hospital, 54 Main Street, Stillwater. So you are going to write in 5 lines. You should start from the first dot. You have to start from the first dot here on the left side. See how I am writing. See, from the first dot. You have to start from the first dot and your letter should be seated on the ground. Your letter should be seated. They should touch the line. They should touch the line. Okay. So that's it. That's how you are going to write. If you want, okay, I'll show you a little bigger style. So this is it. So, right. This would be better. Right. That's fine. I never tried this before, this font. I made the smaller fonts. So, Dr. Lee Waters, Surgeon, Stillwater Private Hospital, 54 Main Street and Stillwater. Okay, now I'm going to ask you one thing. So, I want you to ask you one thing. Okay, do you want to just pass or do you want to, okay, make sure about your pass? Okay, sir, no problem. If you pass, that is enough. Or do you want to lock your success? Do you want to guess your success or lock your success? That means it's a must. Your wish. You want to lock it or try it? You want to try your success or you want to lock your success? That is what I want. Yeah, you want to try, write try. If you want to lock your success, you lock your success. Any one word you write. Okay. So based on your requirement only, I'll give my training. Okay. Otherwise, if you just want to pass, why should I give you extraordinary things? So that's why. Okay. Yes. So it's very, very essential. You have to know what you are doing. So 1, 2, 3, 4, 5 out of 10. Okay, I want 2 more points so that I can take one-sided opinion. Yeah. Okay. So now this is the first point. So you can write and you can do that one. Next one, number 2. After this one, you have to leave one line. So leave one line here. Don't use this line. After every component, this is the first component. Okay. This is the first component. So after every component, what you are supposed to do is leave one line. Okay. Leave one line. Leave one line. Finished. So you're leaving the line here. Okay, fine. That's clear. So this line you leave. Next one, after the address, you'll write the date. You'll write the date, where you will get the date from. So, right, you will get the date here. You're going to get the date. Okay, now let us see where the date is. Here it is. So this is the last occasion. This is the last occasion or the latest occasion. So maybe this is the date. Okay. And today's date, is it given? No, today's date is not given. So this is treatment record 23/2/2018 going to 24/2/2018, just one day. One day. So 23/2/2018 and 24/2/2018. So just one day between 23/2 and 24, 23 and 24. Yeah. So now you can see here. All right. This is medical history. And this is the treatment record. Okay. Treatment record. Presenting complaint. Presenting complaint. So she presented on 23 February 2018. And now she went for tests. Tests were ordered. Tests were ordered and referral was given. Okay. X-ray. Referral for X-ray. Tests and X-rays. All other things were ordered. So the next day, the tests came. Okay. She was not admitted. She visited. It was just a visited or presented. So remember that. So you are writing on the 24th now. Okay. So it is 24/2/2018. 24/2/2018. Remember that. So, right. Check it out there. And next. So this is the date. So are you going to write it 24 February 2018? How are you going to write? Are you going to write as it is, what is here? Or how you are going to present? That's the more important point, most important point, not more important point. It is the most important point. So how you are presenting is very important. Okay. The date is 24. Yeah. 24 February 2018. So we are going to take this one. Copy text. So we are going to take here and we have pasted it there, but you have to modify this one 24, then write February. Don't write anything else. Write the name of the month in words. And then, so after that, okay, 2018. So this is how you have to write. So this is, what is the font here? Okay. All right. So I think that one more. Yeah. So 24 February 2018. 24 February 2018. Then again, you leave one line. Okay. So you leave one more line here. This is compulsory. Yeah. So you're leaving one more line. Then you'll write the salutation. Okay. Salutation. So salutation is dear Dr. Waters. This one will come. This dear Dr. Waters. This should come here. Okay, dear Dr. Waters. Okay. Now this is a mistake. It should not be full name. Okay, you have to write the second name, Waters. Okay. Dear Dr. Waters. So then you can put a comma here. Dear Dr. Waters. Then next. So again, you have to leave one line. Fine. Next one. This is called the this is called the salutation. Dear Doctor and Water. Second name only you write. Don't write the first name. Second name only. Then next here, you will use the subject line. Subject line regarding RE colon. Regarding RE and a colon. Regarding. Regarding whom is this letter? Space. Regarding who is this letter? Now let us see. This is regarding Mrs. Carol Potter. This is okay regarding Mrs. Carol Potter. Copy text. So this is regarding Mrs. Carol Potter. So copy paste. That's all. Don't make any changes. Regarding Mrs. Carol Potter, comma. Then again go to the case notes. Here date of birth is given, so write date of birth. Copy text. Or aged 70. This also you can write. But when date of birth is given, first write date of birth. So here. Now this is date of birth. Date of birth is here. DOB. So when date of birth is given, you write that one. Copy text. So here it is, date of birth. Colon. Yes, this is how you are supposed to write. This is how you are supposed to write. So that's it. So date of birth. So address, then date, then salutation, and subject line. These are the 4 things which you have to write here. Okay. And now let us see. For example, next will come the body of the letter. So leave this body for this page, for this body, and leave it till here. Okay. So we'll write somewhere here. Next one. So here it is. We'll leave till here or here. Okay. Just roughly I'm telling. Okay. Roughly. So here you are going to write closing remarks. Closing remarks. Name of the dear Mr. Waters. So you have to write yours sincerely. Yours sincerely. So you have to write yours sincerely like this. Okay. Then leave another line. Leave one more line. Okay. And then what you have to do is here. So what you have to do is your address. So leave 2 lines here actually. 2 lines. At the end here, you leave 2 lines. So 2 lines you leave. Because in all official letters, it will be like that only. So write like that. Sorry. Okay. Next. So write about yourself. Who are you? Here you are a doctor. So write doctor. If you are a nurse, write nurse. This is a doctor's letter. Okay. This is actually a doctor's letter. But for practice, any letter, it's okay. Right? There is not much difference. So everything is the same. So for example, if you are a doctor, write a doctor. If you are a nurse, write nurse. If you are a registered nurse, write registered nurse. If you are a medical practitioner, okay, you can say, what is that? So general practitioner, you have, then if it says GP, then you write general practitioner. So however it is, doctor. So you are a doctor, so write doctor. Okay, and your practice name is Stillwater practice. And you are in Stillwater again. You are a doctor, you are in Stillwater practice, private practice, and you are in Stillwater. So these are the three things will come. Okay, many times they will just change it, and okay, so they will just change it and give just this right now. So no problem, because many people are giving that's okay to learn. There is nothing. Okay, no problem. Even the official notes, some letters are there with both nurse and doctor. No problem. That doesn't make much difference. Okay, so here you will write yours sincerely, then a doctor. If you are a doctor, write doctor. If you are a nurse, write nurse. That only makes the difference there. Otherwise, it's everything is the same. So doctor. Then after doctor, it is a Stillwater private practice. And it is in Stillwater. So like that. Stillwater private practice is in Stillwater, remember. Okay. Stillwater private practice is in Stillwater only. Right? And then, so you're writing also to Stillwater. Okay. Address the letter to Lee Water Surgeon, Stillwater Private Hospital. That is Stillwater Private Practice, and this is Stillwater Private Hospital. So try to understand. And it is also in Stillwater. So he is writing to the doctor in the same, surgeon in the same city. Okay. So this is Stillwater Private Practice. Don't get confused with this one. You also write this one also. Okay. Many people just write doctor and leave it. That's not fine. Okay, then why are you writing full address of the patient, the person whom you are sending? So your address also is equally important. So this is the point. And then here it is. Number 2. Okay, you're writing to the date. The date is here. This is the date. So you're writing the date here. Okay, you're writing the date here. How are you going to write 24 February 2022? This is the date. You will get the date here. Okay, that's fine. So this is the date. Point number 2 is the date. Point number 2 is the date. Right. So this will go into the letter. So that's why I'm giving green. Okay. So green. So whichever goes into the letter, I'm giving you like this, where you will get the information. So relevant information. This is called finding relevant information and locating relevant information. That is very important. So this is the date. Number 2 is one here. And then number 3 is, okay, the subject. Okay, the not the subject. This is the salutation. Number 3 is the salutation. Salutation you will get from here. Salutation you will get from here. Regarding colon Mrs. Carol Potter, comma DOB colon 30 December 1947. So this one we have to change there. We did not change it. So this is okay. This is the subject line. Sorry, this is the subject line. And before this one, we have to go to the salutation. Salutation is here. You have to take from here. Dr. Lee Waters. From here, you have to take the salutation. So salutation will take here. That is dear Dr. Waters. The last name and the title. Doctor is title. Okay, doctor is title. So you will take this one. This is the subject. Okay, now let's close it. So this is dear Dr. Waters. Okay, so you can put a comma here if you want. Okay, dear Dr. Waters. Okay, fine. Dear Dr. Waters. That is fine. This is the subject. Fine. Next one. This is only don't those who have patience stay back. Otherwise, you can leave the platform. Those who don't have patience, automatically they will leave the platform. They don't have patience. Patience is a virtue. Patience. Listen. Yes. Why did yes come here? I'm sorry. I am sorry. Mistake is a mistake. You have to accept the mistake. You cannot say, oh, by mistake it came. It's a computer mistake, that and this. Don't tell. Shoulder the response. This is my mistake. I'm saying, yes, it's my mistake. I have done the mistake, so I'm correcting it. No problem. Okay. Okay. Regarding Mrs. Carol Potter. So regarding Mrs. Title Carol, first name Potter, second name, date of birth, then colon, then 30, date December, month, and 1947. So like this, this is the subject line. This is the subject line. So now we know what is where. Okay. Now we know everything what is where. So this is number one. Number one is the address. Number one is the address. Okay. Number one is the address. Okay, fine. Let us label them now. Now I'm labeling them. So this is number one. Number one is the address. Number one is the address. So that's it. This is the label. We are giving it the label. Number one is the address. Okay, fine. Okay, if this is number one, definitely that's good. So we are changing the color. So yes, that's it. So number one is the address. Okay, fine. So once this is address, then we are going for the date. Date is here. This is the date. Number two is the date. Okay. Number two is the date. Number two is the date. So let us take this date from here. So we are taking the information, relevant information. Pick and choose. Pick and choose. So date of birth, no need of space. As it is, how it is there, like that. Yes, Ravanti. So this is the date. So, yeah, close it. Now this is the date. DOB, continuous. Capital letters means it's an acronym, the date. So date you will take from here. Then number three. Number three is salutation. Sorry. Yeah. Salutation. This is salutation. Dear Dr. Waters. This is number three. Number three is here. Okay. Three is salutation. The salutation. The salutation. Three is the salutation. So here it is. The salutation. Okay. That's very fine. So the salutation. You'll take the salutation from the first line of the address. Okay. From the first line of the address, you'll take the salutation. Then from there, you'll go to the subject. Subject is here in the beginning. This is the subject line. We call this is the subject or the subject line. Okay. Number four is the subject. Number four is the subject of the letter. What is the subject of the letter here? Mrs. Carol Potter is the subject of the letter. So we'll take that one now from here. So the subject of the letter is here. Okay. A little messy these things will be. Oh, my computer has switched off. Okay. Yeah, that's it. Okay, fine. So now you can see this one here. This is the subject. We got it here. Then next one. Yeah. Fourth one. Next, fifth one is the body. Then sixth one is the sixth one will come here. So what is that sixth one? Sixth one is the closing remarks. The closing remarks. The farewell we can say. Number 6, the farewell. That is the salutation, and this is the farewell. The farewell, goodbye, or best wishes, or yours sincerely, or whatever it is. The farewell. Okay, the farewell. This is the 6th one. That is the farewell. Okay. So the farewell depends on the salutation. That's why I put it close to that one. The farewell depends on the salutation. Okay. Now, how does that depend? Dear Dr. Waters. So the name of the person is Waters, and you know that the name is there. Dear Dr. Waters is there. Then you will write a dear. Okay. Then here you will write it. Okay, yours sincerely. Yours sincerely. Okay. Now this is what you are going to write here. Yours sincerely. Why? Because you know the name of the person. You are writing to the person, not the professional. If you are writing to the person, that means you are writing, the first line is Dear Lee Waters, name of the person. If the name of the person is there, then you will write yours sincerely. If the name of the person is not there, name of the profession is there, surgeon, then Dear Surgeon, then you will write yours faithfully there. So that is how it is going to be. Yeah, let me finish this one, then I'll go to the second thing, because I don't want you to have any sort of confusion there, because you should be perfect. Simple things you should be having in your mind there, 100%, no doubt. So yours faithfully. The other side is the salutation. Sometimes they will say Dear Surgeon. So you can also have another option that is called a Dear Surgeon. Instead of Dear Waters, sometimes you may write a Dear Surgeon. That also is there, possible. Dear, Dear, D capital letter, Dear Surgeon. So sometimes you'll write like this, Dear Surgeon. This is the second time. Okay, we don't know the name of the person, then we'll write Dear Surgeon. Or we can also write like this, Dear Sir. Okay, Dear Sir. Or Dear Madam. Dear Sir or Madam. Dear Sir or Dear Madam. Or Dear Manager. Like this. If you get like these, then what are you supposed to do? Then for these things, your style will be a little different. Your style will be little different. So this is an option. Okay, this is an option in question. So this is not related to this letter. So I'm changing the color of this one to pink. Okay, this letter will be only in green. These are green things, are those things which are going letter. So this is pink, but means there is a possibility, another possibility. So in some letters you will write like this also. Dear Surgeon, you don't know the name of the person, then you will start with Dear Surgeon, Dear Sir, Dear Madam, Dear Manager, like that one. Then what you are supposed to do is, you are going to write not yours sincerely, but you are going to use yours faithfully for that. Yours faithfully for that. Yours faithfully. Okay, fine. This is how you are going to write. For if you do not know the name of the person, you'll write yours faithfully. This is option 2. You know the person by name, write yours sincerely. You don't know the person by name, you know only by profession. Okay, then you'll write yours faithfully. Remember that. Don't mess up with these things. Do not mess up with these things. So 6th one is already here. So we are going to write yours faithfully. So copy text. We already have done it. Yours sincerely. This is already done. Then next one, 7th one is your personal address. 7th one is. So leave 2 lines, because this is common in all OET letters. You can see, I'll show you the sample letter also. If you want, this is the sample letter. You can see how many lines, 2 lines are left here. You can see after yours sincerely. Okay, before doctor, there are 2 lines. Here, there is only 1 line. But here you can see 2 lines are there. So remember that. So 2 lines are needed for after yours sincerely or after your faithfully, you have to leave 2 lines. Remember that. Now, next one is your address. Point number 7. Okay, this is number 6. Number 6 is farewell. Then number 7, go to the beginning of the letter or go to the writing task. Using the information given in the case notes for a surgical consultation. Okay, you are for surgical consultation. Write a letter of referral. This is a referral letter, and then you are writing for surgical consultation. Require surgical consultation. Okay, that we'll see later in the introduction part. Now coming to the point here, you see very clearly as that, okay, so here it is the address, doctor. So you are a doctor. So here you are going to write 7, point number 7. So the point number 7 is you are going to write here doctor. Then next one, Stillwater private practice. Then next one, it is in Stillwater. Okay, Newtown private practice will be in Newtown, Stillwater private practice will be in Stillwater. Like that, you have to imagine things. So this is the address, your address, doctor, Stillwater private practice, Stillwater. Okay, that's how it goes. Fine. Now coming to the point that this is going into the letter. So it is green. Yeah. So this is your address, sender's particulars. So you are sending your particulars. This is point number 7. Point number 7. These are very easy things. They are very simple. Don't take them lightly. And these are guaranteed marks. Don't miss those things. Don't think that you are not getting marks for that. So they are the compulsory things. Okay, this is point number 7. That is sender's particulars or the address. Okay, so you can take this like that. Sender's particulars. Fine. Now this is blue. So senders, but these are the labels. We call them labels. Labels for the parts or the components which you are writing. So these are the senders particulars. So everything is finished now. So far, so good. So everything is clear. The first part of the session is done and dusted forever. So, right. Now we are getting serious students. So we are taking more important. Earlier, our target was only B. Now we are increasing it to B+. So that is why the quality also will improve. Okay, your presentation. My letters always I'll give you more than this one. I'll give you A grade quality. That is 100% sure. Whether you take it or leave it, that is your problem. But providing the quality is my problem, and I will do that. There is no excuse for that. Now here, you can see. So 7 points. 7 points are already here. 7 points are already here. That's fine. Next one. So this is the 6th one and this is the 7th one. Always write from the first dot. Always write from the first dot. From the top to the bottom, it should be straight line. Okay. In between, you have the body of the letter. So now I'm going to ask you one particular question. Okay. One particular question. I'm going to ask you one particular thing. What is that? So there are 2 parts. Preliminaries and essentials. Preliminaries and essentials. The main course and the accessories. This can be termed as accessories, and the previous one, the main course. Okay. So first one, these are the starters. These are the starters from Dr. Lee Water still regarding these are the starters. And the central part, the body is the main course. And these are the desserts. At the end of the dinner, you will eat that one, desserts, ice cream or salad or something else, whatever it is. Okay. So these are the desserts, you can say. And this is the main course in the middle. So now I'm asking you regarding other than main course. So 7 components. What are those 7 components? 1, 2, 3, yes, 1, 2, 3, 4. Okay, this is one set. Then 6 and 7. 6 and 7. This is another set. So these 6 components. Okay, so concept check. So is that clear or any doubts? Clear or not? Say yes if it is clear, no if it is not clear. So the 6 points which I have explained you, is it clear or not clear? Just if you say yes, I'm very happy, I'll move on to the next one. If it is not clear, you let me know so that I will give you some other explanation so that you will get a clear picture of that one. Yes, I want a yes. 10 seconds, please. 10 seconds. So hit a button, yes or no. Yes. What about the rest? What about the rest? Neetu says yes. Okay. So guests, forget them. So other students, I want you to just comment there. Okay. Diana, yes, Seema. So regular students comment. The guests, okay, no problem. That is their wish. They want to comment or not. But the regular students, please comment so that I can get a clear picture that we can move forward. Okay, now we'll go to the body of the letter. Now, body of the letter. How are you going to write the body of the letter? So, okay. But before going there, I want to give you some more clarity here. So, there are 7 parts. So, what are these 7 parts? Now, let us see here. The 7 parts are, okay, the introduction. Yeah. Introduction. Not the introduction. Okay. The address. The 7 components of an OET letter. So, this is it. The 7 components of an OET letter. So learn these things. This is the order. This is the order. Learn these things. Okay. Learn these things. Okay. Okay. These are very, very essential things. So I'm giving you a totally different color. These are also the labels. These are also the labels, the 7 components of an OET letter. First, the address, the date, the salutation, the reference or the subject line, the body, the closing remarks, and the sender's particulars. Okay, having seen all the others except the body, now let us see what is the body, what does it consist of, and how are you going to present it. So there you say the body. Okay. So number 5, the body. Okay, here you have number 1 is the introduction. Number 2 is called main body paragraph 1. Main body paragraph 1. Okay, let us see what is that main body paragraph 1 later. Number 3, main body paragraph 2. We'll consider that one later. What is it? Number 4, main body paragraph 3. So that also we'll see later because it differs from letter to letter. Number 5, the conclusion. So this is called the organization of the letter. Organization. Many people say organize. How are you going to organize the letter? Everything else is the same. Introduction in the first paragraph, conclusion in the last paragraph. Organization means which comes first, which comes next. If it is an urgent letter, then main body paragraph will be, so I am showing you here. So body. Okay. So let us see here. Okay, fine. Let us take here only. This is the body. Afterwards, we'll check if we can fit in somewhere else. Okay, this is the body. So in the main body, paragraph 1, if it is urgent letter, it will be present visit, today's visit. So urgent letter, I'm talking about urgent letter, then it will be today's visit. Urgent letter means today's visit or today's visit. Okay, that's very clear. And if it is not urgent letter, the most important problem, not urgent, ordinary letter, ordinary letter, then it will be the most serious problem. The most serious problem. The most serious problem. So that is how it goes. Okay. Now here it is. Right. Fine. So the most serious problem. Okay. The most serious concern. Then next one. Second one is, okay, the other visits. If it is urgent, then the other visits, the previous visits. Okay. If it is ordinary, then it will be, okay, the other problems, all the other problems. Okay, fine. Next, body paragraph 3, main body paragraph 3. So main body paragraph 3 will be, you can have either the discharge plan for letters, okay, discharge plan for discharge letters, okay, or histories, okay, or personal information. So we'll see, it depends. They change according to pattern. In discharge letter, discharge plan will be there, or histories will be there for ordinary letters, and personal information will be there. So whichever, accordingly you have to write. Okay, accordingly you have to write. So remember that one. So there may be pattern changing from letter to letter also according to requirement. But the most important option is this one. So you can get along with these things. Okay. You can go along with these points now. So the body of the letter. Right. So introduction and conclusion, they are normal for every letter. Right. Now, how are we going to write this particular letter? How are we going to divide this one? Now, let us see. He is telling you this is a letter of referral. So, referral letter. This is a referral letter. Remember that. This is a referral letter. Number one. And they are asking for. So, he is asking for a surgical consultation. Requires surgical consultation. So, Mrs. Carol Potter requires a surgical consultation. Requires. You are referring for a surgical consultation. So whether surgery is needed or not, to find out whether surgery is not. Surgical consultation. What do you mean by surgical consultation? So this is a surgeon. Dr. Lee Waters is a surgeon. He operates. Okay. He will do the operations. So that surgery is required or not, first of all. If it is required, then they will go ahead. If it is not required, then it will be sent back. The patient will be sent back. So is required or not? If it is required, then it is in their hands. If it is required or not required, he has to assess. So assessment, further assessment. Okay. So he has to assess and then tell. If it is required, move forward with surgery. If it is not required, the patient will be sent back. So that's it. So whether or not a surgery is required, okay, that is very important. Surgery is required or not, you are going to find out. So you are writing a referral letter. So here, what type of sentences can you write? The sentences you can write is always start. Don't write, I am writing to refer, nonsense things. Every time we see this nonsense. I don't understand why you are bringing yourself into the picture. Huh? Don't make yourself great, okay? You are nothing here. The patient is great. The patient is important. Without patient, there is no use of a doctor. There is no use of a nurse. Patient is very important for the very existence of the doctor. If there are no patients in the world, then there are no doctors. That's all. If there are no students, that means there is no teacher. If the students are ready to learn, the teacher is there. See, now only 15 students are there. Because 15 students are there, I am here. If you are not, if you leave this chapter and go, then I will not be there at all. Why should I be there when there are no students? That's it. So when there are no patients, what is the use of a doctor? What's the use of a nurse? Like that. So patients are important. This is called patient-centered operation or student-centered learning. Now, what I'm doing is student-centered learning. This is not teacher-centered learning. This is student. What is good for the student, what the student requires. See, for example, whatever you require that I am teaching, you will stay here. If you think that I am teaching nonsense, then you will not stay here. There are some people who don't know what is sense and nonsense. They don't have common sense to differentiate between sense and nonsense. So for them, leave them. And those who think that it is nonsense, they'll just leave and go. Leave, forget them. Those who think that this is valuable, they will always stay there and they'll get good results. That's it. We don't bother about the other. So what I'm telling you is, be sensible. Be sensible. Common sense is very important. What is important? Who is important? Subject is important. What is the subject? Subject is here. Subject is here. Where is the subject? Mrs. Carol Potter. So it is important. Subject is Mrs. Carol important. Patient details. Patient is important. Mrs. Carol Potter. Then why are you bringing I am writing to refer? Utter nonsense. That means it is very, very, very ordinary style. That's it. So start with Mrs. Carol Potter. Mrs. Carol Potter. So already you are writing the subject. Mrs. Carol Potter, you already wrote regarding Mrs. Carol Potter. It is already there. In the subject itself, you have taken the full name. So why do you want to take Mrs. Carol Potter? No need to take Mrs. Carol Potter. Just say Mrs. Potter. Carol is not required. Mrs. Potter, comma. That's it. Mrs. Potter, comma. That's it. Mrs. Potter, comma. So you take the second name. Only in the subject place you write. Otherwise, everywhere write only the second name. Don't write the first name. If it is below 18 years, then you write the first name. Otherwise, don't write. For children below 18 years of age, use the first name. So it is Miss Carol. That's all. Carol. That's all. If it is above 18, then Mrs. Potter. That's all. So Mrs. Potter. So Mrs. Potter. So we are writing that here. Mrs. Potter. Come on. Next one. What is you can write 7 different things here. So you can write 7 different things in the introduction. What are those 7 different things? Now let us see. Is it the signs and symptoms? So signs and symptoms, number 1. Who signs and symptoms? Number 1. Number 1 is presentation. Presentation. Number 1 is presentation. That means the patient came to the clinic. This is a presentation. So you start with the presentation. Okay, he presented with. Okay, Mrs. Potter, who presented with. So you will start like that. Presentation, presented with. Then next one, signs and symptoms. So when he presented with the signs and symptoms, or who has signs and symptoms. That is the second option, signs and symptoms. Then the third option is admission. Admission. So who was admitted? Who was admitted? So signs and symptoms were there, so he was admitted. Then number 4th, after admission, he was diagnosed. Diagnosed, okay. Or preliminary, preliminary diagnosis. So preliminary diagnosis. Preliminary diagnosis stage. Preliminary diagnosis stage based on the signs and symptoms. Next, 5th one is diagnosed. Confirmed, that was diagnosis. So who was diagnosed with? Diagnosed with. It's confirmed the problem. Diagnosed with. Okay. So next one, number 6th is diagnosed with recuperating from. Recuperation. So recovering. So presented, signs and symptoms, admission, preliminary diagnosis, and before that one, there is another one, 6th one. That is, okay, this is 7th one. Sorry, one thing is missing, I told, no? One thing is missing. And this is undergoing an operation, underwent stage. Okay, underwent surgery or operation or something. Okay, underwent surgery. And afterwards, finally, recuperation stage. So I think you understand the 7 stages of the patient history. So 7 stages of the patient history. This is very important. This is very, very important. Which one is more there, you have to see, and based on that one, you have to write. Is he in the recuperation stage, or undergone an operation stage, or diagnosed stage, or preliminary diagnosis stage? Now it's preliminary diagnosis and sending for further assessment. So to the specialist, like that one. So you can understand that. Then next one, admission. He was admitted to the hospital. He presented. Yeah, he presented. And there are signs and symptoms. No, more than signs and symptoms. He was already diagnosed with osteoarthritis. You know that. Now, what exactly he wants? All these things are very important. Now, my question is 7 scale, 7 stage, 7 stage, 7 stage show. So now, in which stage he is in? In the 7 stages, what stage he is in, you have to identify. Okay, is that clear? So that is the point. Is that clear? Say yes if it is clear. So we'll move forward. Is that clear? If you are clear, say yes. If it is not clear, ask me so that I'll clarify your doubts. So there are 7 stages, and all of you know these 7 stages. There is no doubt regarding that one, because you are handling the patients very clearly every time. So presentation stage, signs and symptoms stage, and admission stage, preliminary diagnosis stage, afterwards surgery stage, and recovering stage. So 7 stage history here. Okay, the patient. So you should identify which stage is he. That you have to write here. Mr. Potter, who was diagnosed with osteoarthritis. No, this is not osteoarthritis. Assessment, likely worsening osteoarthritis. That means this is preliminary diagnosis based on signs and symptoms. Okay. Osteoarthritis is already there. We know that one. But worsening osteoarthritis. Okay, likely means possibility. Possibility means not final diagnosis. It is preliminary diagnosis. Okay. Okay. Who has signs and symptoms suggestive of worsening osteoarthritis? Like that you can say. Whose signs and symptoms suggest worsening osteoarthritis? Like that you can say. Mrs. Potter, comma, who has signs and symptoms. This is what is the preliminary assessment. So you are sending them for surgical consultation. Okay, possible chances. Who has signs and symptoms suggestive of, okay, Mrs. Potter, who has signs and symptoms suggestive of worsening osteoarthritis. So here it is. Likely means possibility. Okay, suggest of worsening osteoarthritis. OA means worsening osteoarthritis. OA means osteoarthritis, comma, requires, don't write requires, is being referred. This is a referral letter. Is being referred for a surgical consultation. And any joint replacement if necessary, and a knee joint replacement if required or if necessary. That's it. That's it. So there you are. Mrs. Potter, who has signs and symptoms suggestive of worsening osteoarthritis, comma, is being referred for a surgical consultation and a knee joint replacement if necessary. This is what you have to write. That's all. Okay, that's what you have to write. You are referring to that person only. No need to say is being referred to you. To you is nonsense, because you are writing to him only. Why should you say to you? For example, I am teaching to you. Why should I say I am teaching to you? I am teaching. I only am teaching. Nobody else is teaching. I am teaching. I am not singing. I am teaching to you only because you are the listener. So why should I say I am teaching to you? All the three are unnecessary. They are irrelevant, redundant, unnecessary. When you know that I am teaching, I am doing, and you can understand, I need not say I am teaching. You know that what is happening. So I need not say I am teaching. Then you are already there. So I am teaching you only. So all these three are not necessary because they are understood. So understood things are more than necessary. That means they are not required. So eliminate them. Eliminate them. So Mrs. Potter, signs and symptoms suggestive of worsening osteoarthritis, is being referred, passive voice. I am referring, active voice, no need. Is being referred, passive voice, for a surgical consultation and a knee joint replacement if necessary. See here, refer for surgical consultation and the possibility of knee joint replacement if necessary, and a knee joint replacement if necessary. Is being referred for a knee joint replacement if necessary. So actually he is referred for surgical consultation, and following that surgical consultation, if necessary, knee joint replacement. That's all. So everything is clear. Introduction clear, done, right? So done with the introduction. You can write in any way you want. Okay, now you can also say, Mrs. Potter, who presented today with the complaints of worsening osteoarthritis, okay, is being referred. So, or today, okay, Mrs. Potter has signs and symptoms suggestive of worsening osteoarthritis. Full stop. She presented today, okay, with the complaints of whatever you want to write, you can write. Otherwise, she is being referred for a surgical consultation and a knee joint replacement if necessary. So however you want to write, change, modify, and write. No problem at all. Okay, but only the thing is quality is quality. Okay, which is the best possible stage of these 7, those you can take. 1 minute, please. These are the 7 stages. Yeah, these are the 7 stages. And coming to the point here, this is the introduction. Let us take this introduction. Take any introduction you want. This is not the only one. There are 101 types you can write. You can change anything and anyhow you want to write. Even I am referring Mrs. Potter is also right. I'm not saying it is wrong. It is also right, but it is active voice. When you are using active voice, the person who is writing, I am writing, I is becoming important. I is not important. Don't boast of your greatness here when there is nothing. Any nurse can write this letter. Any doctor can write this letter. So you are no greater than any other doctor. You are no greater than any other nurse. So why do you want to take unwarranted benefit? Saying that I avoid that one. That is not required. So this is the, you can write any introduction you want, This is one introduction I am giving you. I'm not writing in the letter here. I'm not pasting everything here, okay? That you fill it up. You fill it up, all those things, okay? Okay, fine. I'm giving it in the case notes only. Just one example, one solid example. There are 101 ways, out of which one I am giving you, if necessary. Sorry, full stop should be there. So full stop. Full stop, full stop, full stop. Full stop. Where is that? Right. Full stop is very important. Many people think, oh, comma is important, full stop is important. For that also marks will be lost. Yes, yes, and a double yes. Okay. So this will go into the introduction. Right. This is a compound sentence. Number 1. This is not a very ordinary sentence. If you write like this, you will get not a B+, you will get A grade. That's the rest of the things you can do yourself. Anyhow, you can write. You are able to write B grade sentences. You are able to write B+ grade sentences. So why should I give B grade sentences? I'll give only A grade sentence. That is what is the difference. This is the extraordinary sentence which I have given you. Afterwards, that is up to you. So now let us see our sample. In the sample letter, what he has given, let us see here. In the sample letter, thank you for seeing Mrs. Potter, a retired administrative assistant, and considering her for a possible knee joint replacement. She is a 70-year-old woman who is normally well. She has well-controlled hypertension, long-standing osteoarthritis. All these are there. So this is an average letter. OET has given an average letter. Yes, yes, and 1,000 times yes. This is an average letter. If A grade letter is given here, then everybody will run away from OET. They will not even join OET. They don't want to even write OET. Okay. So they will give ordinary letters so that everyone can understand. The difficulty level will be average. Otherwise, nobody will buy the books. Okay. Nobody will understand. If it is A grade sentence, if everything is given, then a difficult level, then A grade sentence means B and B plus and C grade students cannot understand. So they will never give A grade quality. Okay. So they will give average quality so that everyone, but extraordinary people can improve that one, and below average people, whatever you do, they will not use. So forget them. So here, when average quality is given, it is used for everyone. Okay. All the people. So every time they will give average quality only, because we prepare the question papers. We know how we prepare the questions. Average level will be more, extraordinary will be less, and very simple questions will be also less. Okay. So 50% average will be there so that everyone will pass. Okay. Now next one. So this is how it is. So all these things are not required, which is important, short and sweet. Only one sentence, the best, 2 sentences better, and 3 sentences good. So better to write in 1 sentence if you can, otherwise write in 2 sentences. So now if you want to write in 2 sentences, how are you going to write these 2 sentences? Let us see here. Mrs. Potter has signs and symptoms suggestive of worsening osteoarthritis. Okay. Mrs. Potter, who presented yesterday with the symptoms suggestive of worsening osteoarthritis. Okay, has presented with the Mrs. Potter's has presented with the signs and symptoms suggestive of worsening osteoarthritis. That is number 1. She is being referred for a surgical consultation and any joint replacement if necessary. This is sentence number 2. You can write in any different ways you want. So now the question is, okay, shall we move to the main body parts? Come on. Say yes if you are okay, or if you want a break, let me know. We are moving to the main part. So, yes. Now, in the letter, we have 3 body parts. We have 3 body parts in the letter. Now, let us see how we are going to write body paragraph 1, body paragraph 2, and body paragraph 3. Yeah, body paragraph 1, body paragraph 2, and body paragraph 3. Right. In body paragraph 1, now this is a referral letter. This is not an urgent referral letter. This is an ordinary letter. So today's visit, only 1 visit is there. So that is normal. Okay. That is normal. So you can write in your own style. So this is not an urgent letter. This is an ordinary letter. Yes. This is an ordinary letter. And this is a referral letter. Referral letter means the other person doesn't know the patient. That means everything is new to the other person. Referral letter means unknown patient. Remember that. Okay, known patient, unknown patient, all nonsense. Referral letter means unknown. Patient is unknown. The doctor is unknown to the patient. The patient is unknown to the doctor. That is what is a referral letter. That is what is a referral letter. So you are referring a patient because the patient does not know the doctor and the doctor doesn't know the patient. You are introducing the patient to the doctor and the doctor to the patient. And you are acting as a mediator between them because they don't know one another. If you are not there, they cannot meet one another in their lifetime like that maybe. So that is why it is a referral letter. You are the intermediary. You are making them both meet. That is how you have to consider this area. Okay. Now, so there are 3 points I have already told you here. First one is urgent letter. No, it's not urgent. So ordinary letter. Ordinary letter means the most serious problem you have to consider first. Then the other problems. Then next one, the personal information is there. So here it's based on these things, you have to get a clear picture. Okay. All right. Now I'm giving you a chance. In the first paragraph, if you see this letter as it is, paragraph 1. Paragraph 1. So what will you write in the paragraph 1 in this letter? I'm going to show you here. So this is the letter. What will you write in the first paragraph? Go through these things and don't just blindly say something. Just go through these things and you'll get a clear picture. Then based on that one, you have to tell me. So this is the first page. This is medical history. These are the medications. There's a family history, social background, presenting complaint. So presenting complaint, you can see here. Presenting complaint. Presenting now means today's complaint. So he has the complaint. That's the knee pain in the left knee. Left knee for the last 12 months. Left knee. Remember that? It is the left knee. Yeah. So that is it. Now second part here. Subjective on examination treatment. Only single visit is there. Okay, so why he visited, you can write. Okay. Okay. Now come on, give your points. After seeing this one, what you want to write in the first paragraph? Write your points. Which one will go into the first paragraph? This is called organization. This is called organization of the letter. Okay. Come on, write down your opinion. What you want to write in the first paragraph, body paragraph 1. I'm waiting for you. Yes. Afterwards, we'll go through that one. No problem. Okay. So first one you will write about, yeah. So let us see. Presenting complaints and treatment given. Very good. Presenting complaints. Yeah, you are right. Presenting complaints is the right one. So because the present one, the only one is there, that is the present complaint. Only one visit. Why he is visiting the hospital? Because he has problem. So that problem. The only problem is he has a pain. Okay, in the left knee. Okay, and that is for the last 12 months. Okay, and it's going on increasing. So that one you have to write. So for the last 12 months, the problem she has in her left knee. That is more important. And now you have to see, okay, you have to see. So then what happened? See, he presented with these complaints. She presented with these complaints. Okay, presenting complaint. Okay, this is presenting complaint. This is paragraph number 1, presenting complaint. Yes, you have to write this one in the first place. Yes, you are absolutely right. This is presenting complaint for the last 12 months. And for this one, what was the medication given? What was the medication given and what is her condition? Pleasant complaint along with the condition. Everything you have to write. Then you have examined him and you have given him treatment or given her treatment. So all these things, this from here, presenting complaint till treatment, all these things will go into the first paragraph, body paragraph 1. All these things, presenting complaint. On the same day, whatever happened is presenting complaint. So this is it, presenting complaint. This is body paragraph 1. Main body paragraph 1. Okay, main body paragraph is presenting complaint. Fine. Okay, then, so on examination, this was found. Okay. So this is on examination. When he presented, you examined. So that's it. Then what treatment you have given? So this is all related to body paragraph 1, right? Body paragraph 1, right? You can see that. So discuss the results tomorrow. Okay, fine. And then what you are supposed to do is, next one, you will write about, yeah. So based on test results, okay. So now you can discuss about these things. Okay. This also is there. Test results and assessment. And this one, medication, you can see here. Current medications you can write. Current medications also you can write. And what other things are prescribed, you can write. So here, what are the other things prescribed? Arrange physiotherapy. So this, you can suggest analgesia. Okay. And what all you want, what he requires. So you can write. So 3 paragraphs you can write. Okay. First one, you can write the presenting complaint. Then second paragraph, you can write about, what you observed, and on examination, what you found, all those things you can say, and what is her condition. Okay. What is her condition, present condition. Okay. You can write about all these things. So this one, if you write body paragraph 1, okay, then this one you can write as body paragraph 2. Okay. This one also body paragraph 2 you can cover. Then next one, last one, you can write this one. Okay. So based on this one, what is required? This is body paragraph, main body paragraph 3. Main body paragraph 3. What are expected? Okay. What you can suggest? Everything. Okay. This will go to the last paragraph. Okay. After being sent there, what he can do is the third paragraph. Okay. Consultation with me, presenting complaint. This is paragraph number 1. Okay. After that, everything, then paragraph number 2. After consultation, what you come to the conclusion and what are the things you are thinking. Okay. That will go into paragraph number 2. And lastly, after leaving from you, that will be third paragraph. Okay. After leaving you, this is follow up. Okay. Follow up. Right. Those are will going to the third paragraph. So you can write in 3 different paragraphs. This is the organization, how you can write. And whenever you are writing, use passive voice. Try to do 4 different things. Number 1, avoid. Avoid 4 different things. So these are the 4 things you have to avoid. These are the 4 things you must avoid. So avoid active voice, sorry, not passive voice. Avoid active voice. Avoid active voice, sorry. Avoid active voice. So avoid active voice. That's it. So these are the very important things which you have to know. Don't use active voice. Use passive voice. These are danger zone. Danger zone. If you use these things, that means there is danger for you. So avoid active voice. Avoid personal pronouns. Avoid repetition of words and phrases. Same words don't use again and again. Then next one, avoid commonplace words like good. Okay. Walk. Instead of walk, you can say ambulation or mobilization. Instead of good, you can say excellent or extraordinary or something else word. Use better words. Okay. A1, sorry, C1, C2 words you use. C2 are better. If you cannot use C2, at least use C1 words. Okay. So now how are you going to write all these things? So 3 paragraphs. First paragraph, you write about the presenting complaint. Second paragraph, you write about on examination what happened and what medication he is using, number 2. Number 3, after leaving from you, okay, right? So on what condition he came to you? After coming to you, what did you find out? Second paragraph. Okay, in the third paragraph, after you leave, after he leaves you, third paragraph. So before coming to, so until, let me give you one picture here. I think it is better for me to give. So condition before, number 1, stages, paragraph stages. So paragraph, this is called, you can say, what is that? Organization of the letter, organization of the letter. So they are in order. Number 1, organization of the letter. Number 1 will be presentation. Number 2 will be your assessment. Number 3 will be your suggestions. Okay. Otherwise, you can say here the patient. First one is the patient is powerful. The patient stage. Second one is the doctor stage or the nurse stage, whatever it is. The doctor stage or the nurse stage. And third one is the surgeon stage. So this is the surgeon. What happens what happened with the patient, what happened with the doctor, what happened with the surgeon. If you can understand this one, that is very clear for you. So patient. So before everything, patient is telling, I have this, I have that, I have this, and he came to the doctor. Till then, the patient is in control. Then after he came to the doctor examined him, tested him, sent for the test, blood test, that, this, X-ray and everything. Then he said, doctor said something. Then afterwards, what doctor cannot do, that's something. So he's referring to a higher authority, that is the surgeon. So when he goes to the surgeon will take care of the patient. So that is what it is. So the patient stage, the doctor stage, the surgeon stage. So these are the 3 different stages or levels. So that is why you are dividing it into 3 paragraphs. Okay. So organization of the letter. So based on this one, so he presented till there general things. Then afterwards, what the doctor found out, what the patient found out, what the doctor found out, and what the surgeon will find out. So that is all different things, the 3 stages. So the patient level stage, then after coming to the doctor, what happened, that stage, then after leaving the doctor, what happened. So before doctor, during doctor, so before, while, and after. So these are the 3 stages. Okay. So the patient stage, okay, 1 minute. I'll give you still further explanation here. So the patient is before coming doctor. So this is called before doctor. Before doctor. Before doctor. Then next one is during doctor. During doctor. During stage. Before stage, during stage. And the last one is after doctor. After the doctor stage. So now I think you understand. After leaving the doctor. So this is how you can think about it. I think you can get a clear picture with this one. Okay. He presented with the complaint. Till then, it is the patient who is taking the responsibility. Then after coming to the doctor is taking the responsibility. Then after the patient leaves the doctor, the surgeon is taking the responsibility. So patient's responsibility, doctor's responsibility, surgeon's. Or before doctor, the patient, during doctor, the doctor, after doctor, the surgeon. Like that you can take whatever way you want, you can take. But that is the difference. So the new students, let me see. So I think you are very clear with what I have explained you. Okay, clarity achieved or attained, clarity attained. So yes or no. So yes or no. Yes or no. Clarity attained, yes or no. Copy. Clarity attained, yes or no. Come on, fast. I don't have time. I have to go for tea now because there are a lot more things. I have to edit your letters and I'm going to send those letters. Okay, please. Come on, fast. I have corrected some 40 letters and I have already edited and posted them. And you can take it from the Telegram channel. Don't expect me to send everything personally. Take it from the group or take it from the Telegram channel. All of them are in a serial. I have already given you the token number. For example, Diana, you have any letter with you? Diana, unmute. Diana, unmute.
Yes, sir.
Yeah. Do you have any token number which I gave you?
Yes,
Tell
sir.
me your token number. Diana. Where is Diana? Okay, Diana is in the United Kingdom. Okay, fine. So was in the Diana is in Maldives now. Okay, 4675. And then any previous letter number, you can just mention there.
4689.
Okay, so 4635. Okay, whether I have posted 4635 or not, I don't know. So what you have to do is go to the classical corrections group and just type there 4635. That's all. Yeah, it is corrected. So 4635 is here. This is Sachin, not yours. Yeah. What is your number?
4689, sir. I told you.
4689. 4689 is recently one. Old one, you tell me, which is already corrected.
Okay.
Diana. Okay. 4674, 4675, recent ones. Yesterday you have submitted those. 80. These are also. So before any letters are there, you tell me.
4615,
Okay,
sir.
otherwise you can just type here Diana. Finished. Just
Okay,
type
sir.
your name, you'll get it. All
Okay,
the
sir.
letters which you have in the name of Diana, they will come there. Diana. See, all these are Diana's letters. So, okay. This is the letter 420. Okay. Diana, let us see here. Yeah. 4207. 4207. So, let me see. Why should I ask Diana when I can find it here? So, 4207. So, just type here 4207 in the search bar. So, there is 4207. Finished. This is 4207. You can just take directly there and you can go finish. This is the letter of Diana Shiba. Okay. So that is the letter. So here it is, Diana Shiva, 4207. So any letter you don't expect me to send to you personally, directly take it. Just put your number there. The number which I have given you. Okay, you can put. So if it is there, that is it is there. You can see the order, how they are going. Order, latest order, you can see. The order is the latest one which was corrected and put. Corrected, many letters are corrected. I'm editing them, that's all. So the letters, the latest one is 4640. This is the latest letter of Joffins. That is the last letter which are edited. Other letters are also corrected. So I am just editing them. Okay, editing is a little hectic process. I am editing these letters. See, so feedback. Yes, you can see here. I have edited till 4647 and these edited. So 71, 4671 till them. It is corrected till 4671. I'm going to edit these letters and I'm going to send now. Okay, I need 45 minutes. So I'm going to edit them and send them. I already corrected in the morning. So you will get those letters within short time. So please, all of you, write this letter and submit me. Write these letters and submit me. Who are their regular students? And I gave 2 letters. 2 letters I gave. So yeah, now I'm going to give you a chance to unmute. So allow participants to unmute. Yes, Anaga.
Yes, sir.
Anaga. So you are going to write 2 letters and send me, okay?
Okay, sir.
Joe Fins. Hello, Joe Fins.
Yes, sir.
2 letters I gave, okay? Second letter I will explain later. 2 letters you have to write and send, okay? Punita.
Yes,
Hello,
sir.
Punita.
Yes, sir.
2 letters today, okay?
Okay, sir. I will send it today, sir.
Elizabeth Joseph.
Yes, sir.
2 letters. I want them now, okay? Then
Okay,
next
sir.
one, say this doctor's name. What is this doctor's name? Hasina? No. What is this doctor's name? Muhammad, it is there. What's your name, doctor?
Nasima Rahman.
Nasima. Yeah, Nasima. Nasima, you also should write 2 letters, okay?
Okay.
And submit me. So,
Okay.
Nasima, was the letter, was the explanation beneficial for you?
Yes.
Huh?
Yes. Yes. I write Carol Potter letter before.
Yeah, but this style, what I have explained, was that
Yeah,
more
yeah.
beneficial for you, or it's just like any other explanation?
No, it's okay. It's good.
It's something different, right? Something additional points
Yes.
you got, right?
Yes.
Yeah,
Yes.
that's
Yes.
fine. That is what is my intention. Okay, next one. Neetu PS. Hello, Neetu.
Yes, sir.
Yeah, Neetu, I want you to write these 2 letters and send me. I don't know who is this OT. Meera Manoj. I don't know who Meera Manoj. Okay, welcome. You have to write and you can submit, no problem. Okay, so Punita. Hello, Punita. Seema Asmita. Write both the letters and
Yes,
send me,
sir.
okay? Both
Okay,
the
sir.
letters and send
Okay.
me, and the night I will take you the second letter explanation. And don't miss.
Okay.
This is morning's lecture, that is evening's lecture. Night I'll give you another lecture for another writing. Then Sravanti. Hello, Sravanti.
Yes, sir.
So is that clear to you? You have to submit 2 letters to me, okay?
Okay, sir.
And what are the 2 letters? One is this one, and the second one is mega group. What is the second letter? The second letter is Margaret Helen Martin, okay?
Okay, sir.
So I have sent Carol Potter, and second one is Margaret Helen Martin. If anybody has
Yes,
already written, you can write some other letter, or you can write. So today evening, I'll teach this Margaret Helen Martin. Today evening, before we go to sleep, we'll complete this letter. And all of you complete 2 speaking sessions with Ashwini and 3 sessions with Manasa. Okay, and I'm going to take 1 session for you afterwards. So finish those sessions. And today evening, we will have listening part C. Listening part C. Okay. Be ready for listening part C today evening. Okay. Now your valuable feedback, please. Your valuable feedback, please. So come on. 1 minute I'll give you. Write your valuable feedback.